Welcome back in. All new here at 4 o'clock. As part of Black History Month, Denver Health is highlighting the importance of representing minorities in its research, which helps the hospital improve the care they provide to everyone. So joining us in studio now to discuss this very important topic is Dr. Randy Miles, Associate Director of Radiology and Chief of Breast Imaging at Denver Health. Thank you so much for coming in again. Good to see you.
Thank you.
So this is a big topic to cover. Let's dive right into it. Talk about the importance of equity in research.
Definitely. One of the main pillars of Denver Health and the mission is improving health outcomes, and research plays an important role in that.
And so what are we seeing in the research? If you break it down, can you give us some of the statistics, or what are you guys seeing?
Yeah, definitely. So research improves it. Research informs how we inform clinical guidelines and treatment protocols. So research is important in every single field at Denver Health, and that's why we're doing so much research in all of our different departments.
And what kind of research? Can you elaborate that are you taking the time to do? It's so important.
Yeah, definitely. One of the big things is that we're getting into the community. We're trying to find out what barriers to care that many patients that we serve may experience, just so that we can understand how we can help overcome those barriers and to help improve care for these patients who often experience disparate health outcomes.
And when you talk about research, is there any way that people can get involved in this research if they are a minority looking to change the culture and the stigma?
Definitely. One of the main ways that you can get involved in research is just by talking to your doctor. There's many studies and many trials that your physician may know about that they can help enroll you in that can be extremely helpful, especially for diverse patients.
And we know we're seeing these inequities in the healthcare system all around. Where does this stem from?
Treatment and clinical protocols are often guided by research and funded studies. What we do see is that there is a disparity in terms of the diversity in patients that are enrolled in these research studies. Because these studies inform how we treat patients, a lot of that informs many of the disparities that we see. So we need to increase representation in terms of the diversity of patients that are involved in these research studies so that the research study results that we see, we know applies to all patients.
Yeah, so it sounds like a lot of outreach is happening. Can you talk about what Denver Health is doing specifically?
Yeah, I think Denver Health has done a great job of reaching out into the community and just educating patients about the importance of research. There's so many, I know there may be patients that may be afraid of research, or there may be some distrust, but we really want to make sure that patients understand that there are so many protections and laws that protect patients. We want to make sure that patients understand that they can ask questions, and also make sure that they understand the importance and how this can not only help them, but help the community and make sure that we're treating all patients.
And we're just hitting the tip of the iceberg. This is such a big topic. Thank you so much for coming in and giving us your perspective. Dr. Randy Miles with Denver Health. Thank you.
Thank you.